بسم الله الرحمن الرحيم. السلام عليكم ورحمة الله وبركاته. Good morning, ladies and gentlemen. Good morning, Mr. Sharif, the CEO of King Fahd Specialist Hospital, Executive Directors, and my staff colleagues. It's my pleasure to introduce to you the monthly General Staff Meeting of September 2021. And we'll start with Patient Safety Culture Survey result and Ms. Safa Jawada, Director of Quality and Patient Safety Administration.
Assalamu alaikum. Sabahkum jamian. So today, as my colleague mentioned, I will be sharing the result of the hospital survey on patient safety culture that took place earlier this year. So as you all know, the survey was conducted in collaboration with the Saudi Patient Safety Center earlier this year, and particularly on 17th of January. 366 hospitals across the kingdom participated in this survey, and E1 contribution represent 6% of the responses. The response rate that is targeted by the Saudi Patient Safety Center was 50%, but as always, since we and King Fahd Specialist Hospital, we aim higher, we set an internal target to reach 70%. And guess what? Alhamdulillah, we reached that target, and this is all because of your contribution and commitment. So all the hospitals across E1 reached the target except for one hospital. And the survey has 12 domains, ranging from communication openness, event reporting, hands-off and transition, teamwork within unit and across unit, and so forth. Now this is our result for this year and in 2019, ranked from higher to lowest based on the positive responses. If we are comparing the result, our result this year to 2019, we had a minor drop in only 3 domains, which are teamwork within units and across units, and management support for patient safety. But as you can see, the drop is very minor. Alhamdulillah, we improved in so many domains, like around 5 domains, but the most significant improvement is in 2 domains, which are supervisor, manager expectations and action promoting patient safety. We increased by 3%. And in communication openness, we had an improvement of 5%, which is really a significant improvement. Now looking at the negative responses or negative results per domains, it is clear here in the graph that we, staffing and non-cognitive response to errors had the highest negative responses. So we wanted to dig deeper and look into the questions under those 2 domains. So for non-cognitive response to error, the domain itself talks about the errors related to event reporting and sentinel events and those mistakes. In the committee that is taking care of this survey, we did some minor or simple calculation, and we reached to a conclusion that any question with a negative response that is more than 43% is considered an area for improvement. So for non-cognitive response to error, this question scored 52% in the negative responses, and this is one of the areas for improvement as hospital-wide for our hospital, which is staff that they worry that their mistakes are kept in their personal file. Now in terms of staffing, same, we followed the same methodology. So those 2 questions scored higher than 43%. we work in a crisis mode, trying to do too much too quickly, and that the staff work longer hours than expected or than is best for patient care. So, as a hospital-wide improvement or action plan, for this particular question, which is staff worry that the mistakes are kept in their personal file, we're aiming to promote a just culture approach, not a total non-punitive response or non-punitive culture. What does a just culture mean? It means that we have to create a balance between patient safety, disciplinary action, and accountability. So if a staff is involved in a patient safety event that leads to patient death, and it is proven by the investigation, by the analysis, that that this mistake is a result of a system error, saying that, let's say that the policy is not clear, training was not provided to that staff, then no disciplinary action should take place, and it's not going to be placed in the employee's personal file. The opposite also applies. So if the employee, the action done by the employee that leads to patient death is a result of a reckless behavior or negligence, then disciplinary action will take place, and for sure it will be kept in the personal file. And we'll do this utilizing a verified tool, which is a well-studied tool called Decision Tree, to determine the level of accountability for staff involvement in patient care and sentinel events. What we're doing this year is that we'll ask HR not to accept any disciplinary action related to those events to be placed in any employee's file unless the tool is available and the tool is approved by the executive director of that related service, and the staff is actually, there was a meeting with the staff, the tool was explained, and the result was explained to that staff, and he understood well why he was labeled as, for example, reckless behavior or negligence. As for, let's take some facts. So we retrieved our data related to sentinel events and adverse events. So in the past 3 years, we had a total of 25 sentinel adverse events investigated. And guess what? Only one staff there was a disciplinary action for one staff, and it was placed in his personal file based on the decision tree that we used. So if we look at the fact, maybe it's just a perception of the staff that they worry that anything will be put in their personal file, but actually only one staff, and that was done just this year. Okay, for the other domain, which is staffing, related to staffing, working longer hours and working or trying to do too much on each, the staffing level in each department. Any department has more than those categories or those questions with negative responses higher than 43%, then they will develop their own action plan. And by that, I conclude my presentation for today, and I'm ready to have your questions. No questions? Okay, thank you all.
Can I check if there is any online?
بين عندك الأونلاين.
27.
Where is it?
27 online.
But it's not here.
Thank you, Mustafa. Now we'll be with the CEO of King Fahd Specialist Hospital, Mr. Sharif Adnan Umar, and the CEO of the Peak Hospital.
بسم الله الرحمن الرحيم. السلام عليكم ورحمة الله وبركاته. صباح الخير. Thank you again for joining us on this quarterly meeting. I wanted to just give some quick updates on items that we've talked about in the past, or as I've visited the different departments over the past several weeks, common themes that have been asked or questioned about. So for the first one is Green Hall. Alhamdulillah, I think we're approaching 500,000 vaccinated individuals in Green Hall, which is a great accomplishment. But I'm equally happy to say that based off the number of vaccination sites that have opened up over the Eastern Province, there's enough capacity now that we're able to begin closing Green Hall. So inshallah, this Saturday, September 11th, will be our last day of providing vaccinations. I know this has been a burden on the hospital and those people that we've asked to go out to the Green Hall, but obviously it was something that was critical to the community. If you think about the Eastern region, there's roughly 3 million individuals in the region, and we did 500,000 of those vaccinations. So it was a large portion of the vaccinations that were provided. So we are excited to have our colleagues come back starting most likely Monday to Tuesday. We still have some items that we have to begin removing and making sure that we get some of our stuff back. So Green Hall is complete, alhamdulillah. The second is we're happy to announce that after a couple of years of working through a lot of different issues, we finally have received the Ansari Hotel. It's been cleared by all the proper evaluators, and now it's under KFSH responsibility. We will this coming week, most likely Tuesday or Wednesday of this coming week, begin to operate it and move patients or their families into the Ansari building. Right now we have roughly six families that are staying in some of our apartments, and those will be the ones that will move first. And then once we are sure that our processes are smooth, then we'll open up more rooms. Ansari Hotel has 54 private rooms, so it's a large capacity, and I think it'll be a great benefit for our patients. The mission of the Ansaris and from KFSH standpoint is to have a place that for those who can't afford to pay for a hotel or have highly sick family members that are in our hospital that need to go back and forth frequently, that will allow them a comfortable accommodation. The next one, which is probably maybe the second or third most asked about topic, is the new housing compound. So alhamdulillah, since our last discussion, we've made a lot of progress. So I can't remember if we had before or after the last session we have fully secured the budget for the new housing compound, and we have received the approval from our local rental committee that it meets all the requirements. And the last step is that the MOH housing committee needs to review the compound. Alhamdulillah, we were able to push them and get them out 2 days ago to go to the compound to visit it. So now their committee will meet. We've pressed them that hopefully they'll meet within the next 5 to 10 days to make the final conclusion on the assessment. And then from there, everything should be complete, and then we will submit the contract for signature. As far as the timing of it all, we're pushing hard because we have 2 of our compounds, their leases expire in November. And so what we're trying to do is if we can get everything done by mid-October, it will give us a month to begin coordinating the moving of those first 2 compounds. And then once we get that complete, then we'll move into the final compound, which we have a little bit more time on. One of the questions that you'll see later is where is the compound located? It's the compound that was selected is Grand Village. It's located near Othman Towers, Kopinski. So it's like in between Dammam and Khobar. So for some of us it'll be a closer drive, and for some of others it may be a little bit further. But I think it'll be nice to have everyone in the same location. So again, we'll share more information as soon as we have the final plan with exact timing and everything. Obviously, the move is going to be complicated. We have 300, 330 people living outside of the hospital. And so we will have to partner together on the move to make sure, I'm sure some of us have lived in the compound in our villa for 8, 9, 10 years, and you accumulate a lot of stuff over that period of time. So we have to figure out the transition to hopefully be as smooth, but obviously anytime anybody moves, even if it's one house, there's always going to be some hiccup, some problem that we just have to be patient about. Employee reimbursement, I'm also happy to say we were able to approve through our other revenue about 11 million reals about 3 weeks ago, mainly covering overtime, visas, Gsm fees, all the things that we have owed everyone throughout the hospital. There's still about 3 to 4 million reals of extra funding that we need to do, but we're just waiting to finalize the paperwork. Some of it is some more overtime, and then tickets is really the next biggest bucket that will make sure that we get done over the next, inshallah, 3 weeks, 4 weeks to get it all approved and processed through the system, and then we'll fund it again through other revenue. So our goal is let's say by November, we should be caught up on all of our old reimbursements to all of our staff. It's not something that I think any of us wanted to happen, and we want to make sure that the process and the protocols are in place so that we don't have this fall behind again. But I think we took care of, as I said, probably about 14 to 15 million. We've paid 11 million of it. The other one that, this is probably the second most asked about, is leave approvals. The time that it takes to get a vacation approved, or the time that it takes to get a visa. So we've had to be a little bit strict, because even though we weren't a COVID hospital, we did have a COVID center, vaccination center, and there was some stipulations around us on that. So now that we're sunsetting the center, I met with HR, and we will go back to the old way of doing vacation and visas. So it won't have to come, vacations won't have to come to the COO office. We'll be able to deal with it at the chairman's level or the director's level. And the visas will be processed as they have in the past. We do still need to be a little bit cautious, and we'll follow the same process, but we do need to be still a little bit cautious with those that are still in the banned countries or the countries that require 14-day quarantine. I know as healthcare workers, we are exempted from that, but it's still a risky endeavor. And as we've seen more and more now, vaccinated people contracting COVID, we still need to be cautious around the COVID requirements. The numbers are down, but it takes one or two people to come in infected, and then we'll have an outbreak within the hospital. So from a vacation and leave standpoint, inshallah now things will go a little bit more smoother. It's still important from you as an employee standpoint to plan ahead of time. I know we still sometimes get requests that it's a week out or 2 weeks out, and it does take time to process some of these things. So please, as far as advance that you're going to go on vacation, submit your leave, submit your request for visa, and HR will accommodate that. As far as new hires, as you know, for the large part of the year, the MOH, based off of direction from, I think, Ministry of Finance, has put a hold on hiring. Maybe a couple of months ago, we were able to start hiring Saudi nurses and Saudi physicians, which we have begun hiring that. And then recently we started getting some relief around the non-Saudi physicians, and then we're requesting to begin the hiring process for non-Saudi nurses. For the allied health, we did get approval for a specific number of positions within allied health. I think it's something like 16 positions that we were approved to hire. Specifically, the ones that we've prioritized, that we asked for an exception for a number of people, were MRI, where we have a large deficit, and it's created a backlog, a waiting list. But again, alhamdulillah, that we've been able to get some relief there. The only category that we still have a hold on is what's deemed administration. And so if there's specific needs, we can try to advocate for those, but honestly, those will be harder things to get approved. But physicians should be clear. Nurses, for the most part, although we have to get a little bit more clarity around the expat nurses. Allied is opening. I won't say it's as open as the first two categories, and then administration still more on a hold. The next thing is projects. We presented all the projects last time. Alhamdulillah, we've been able to work through all the requests for proposals. We have about, I'd say roughly 100 million of projects that we've internally approved. So now we've submitted all of those projects through the system, and right now the process is from us, they go to bids and contracts. Part of the issue that we're facing is that from a national standpoint, it was deemed that no capital projects would be approved at this point in time, but the definition of what a capital project is unclear. Is it a real threshold, is a repair a capital project, or is it a new project? So our plan, what we do know is any project that's less than 500,000 real we can process, and so we've processed those projects. Unfortunately, that's not a lot of projects. As you know, most things that cost, especially when you're doing the work in the hospital, cost a lot more. So what we've done is submitted all of our projects with the hope of, what MOF has said is submit them to us, and then we'll make the decision as far as what category do they fall into, if it's truly a capital project or if it's an infrastructure project. So for example, like we know that we have issues with our pipes in the hospital. One of the projects is to replace all the pipes in the hospital to prevent the leaks. We believe that's infrastructure, not necessarily capital project, and those are the type of things that we're going to try to advocate for. If it's building a new building, like we have in a couple of the projects, I think those will be harder to get approved. But we'll advocate more for the infrastructure stuff that continues to hamper us, whether it's us having to close beds because of water leaks, or we have critical like PACS upgrades that we need to do. These are projects that we really need to get moving and funding on. Medication budget. The next thing is, for this entire year, we've talked about in the past our issues with old balances and having to clean up some of the liabilities that we had from old invoices that we haven't paid. Alhamdulillah, probably I think 2 weeks ago or 3 weeks ago, we were able to get support of another 180 million from the Ministry of Health to support us on medications and then medical supplies, non-medications. This amount is intended to help bridge us for the rest of this year until we get into the new year, and we'll have the new budget. So we've submitted the tender for I think probably 160 of the 180 million, and so the purchase requests have gone out. Inshallah, we'll start receiving some of the medications. Honestly, there's also the issue of general shortages. For example, we have one oncology drug that's a common drug that we've had a PO out there for a while, and it's just a national shortage, and so everybody's kind of struggling to get into it. So while we have some relief, and I won't say complete relief from the budget, we still have to work through the process of getting the medications in. We've seen a spike up in our 937 calls, which I would expect because a lot of patients of ours are frustrated, about one, getting access to the medication, the quantity of the medication that we're providing, or cancel or delay of treatment. I know all of you guys have done a good job at trying to mitigate or manage the patient's expectations, but obviously anybody put in their position, especially with a significant illness, will get mad. So hopefully within the next 2 to 3 weeks we'll be able to start receiving a lot of the medication that we're in low or zero stock on, and provide some relief to them. And then finally, annual increases and end of service. I'll take end of service first. As some of you know, RL2 annual increases. We're still in the process, and unfortunately we're not making a lot of progress in the court system at getting the legal case resolved around the past 2 years of annual increases. and that's why we still haven't done the annual increase for the expats this year. That's also tied to the end of service. So as you know, when we have employees leaving, what we have had to do from a legal standpoint is reserve 2 years worth of increases just because it's unknown. The positive news on the end of service part is we did have 2 cases filed against the hospital by 2 of our employees that had retained it, and the court ruled that it's their money to keep, which is a very positive sign for the end of service and the annual increase component. Unfortunately, and I was pushing legal this week, we don't have the final ruling from the court to stop the process or to reimburse those that we've already deducted the money from. So both Dr. Abdelaziz and myself are pressing legal that we need to get resolution on this matter so that we can get back to normal patterns. I know this is something that, one, it's caused a lot of frustrations, it's caused distrust between a lot of you and the hospital, and believe me when I say this is something that we don't want to deal with. We want things to, we hope that things work out in a positive way, that we can continue to keep the past 2-year increases in the salary and then implement this year's increase. But it's still not fully finalized through the legal system, and we have to wait for that for us to implement the final recommendations. So I'll quickly go into the questions from last time, and we do have a lot of questions. Some of them are repetitive to what I talked about earlier, so I may just glance over some of them, and then some will get into more specific. So the first one ties back to the 10-year mark, and this is one of those things that there's really no good answer. I know we've lost a couple of staff who resigned because they were nervous about they were approaching the 10 years or past the 10 years, and they had another opportunity which gave them greater security. It's hard to say yes, don't leave. You're guaranteed a job here, but the reality is, from a clinical standpoint, as long as we're providing, from both clinical and administrative standpoint, as long as we're providing a strong justification, so it's really up to the directors and the EDMCA to articulate why this person is critical to the needs of the hospital. We haven't had any rejections from the Ministry of Human Resource to those requests. There is, the question is, what are the options KFSH has? Obviously, we have to abide by the rulings. From a clinical standpoint, there are possibilities of exceptions that some people have authority within the cluster to make exceptions. So there's less concern around the clinical positions than the administrative positions, which will be a little bit harder to make exceptions for. But at this point, like I said, as long as we have been strongly justifying the need for the individual, we haven't received any denials. It does prolong the process because, it's not just, I know that, you submit for the Iqama renewal and it happens. It does take a little bit longer to gain the approvals to get to the point of getting to the Iqama, and that's where HR is trying to start the process as early as possible, but not everything is in their hands in terms of being able to control the whole approval process, and some of it is, a lot of it's, we're at the mercy of waiting for the response from outside. The second question I addressed relative to the vacation systems and going back to the old way. The third question is around the increments, but it's a very specific question, and what I would say is if you have specific questions, I encourage you to go to Mr. Thamer, HR, the personnel department, because they will sit down with you and work through any questions that you have relative to whether it's end of service benefits or the increases. They're there to serve. I know they started a separate email to judge any questions or customer service related things. So instead of covering the detail of the math in this session, I would encourage you to go sit with Human Resource, and they're happy to have the conversation with you. This one is specifically GCC. I have the answer, and it's a very technical answer. But relative to the GCC employees that are not getting increases, it has to do, so again, this is one that if you have specific questions, I would encourage you to go to HR, but it has to do with being placed on the Saudi salary scale, and a lot of our GCC employees are still on the old salary scale, and so to get the annual increases, you need to be moved to the new salary scale. So again, this is one of those situations that it's a case-by-case basis. This is not a GCC unique thing. We do have some Saudis that are still on the old salary scale and are not getting increments. So it just depends on which scale you're on, drives whether you're getting the increments or not. Providing employees with eligible dependents on complete health and dental coverage. This one ties back to contract. So, you know, if you're on a family contract, then you do get the coverage. If you're on a single contract, then you know, obviously that coverage is specific to you. So again, this one goes back to an individual basis. One of the issues that I've heard this week is that some of our staff is struggling to get access to the healthcare system. So, you know, obviously most of the healthcare that that our staff is accessing is here within KFSH. And so if we get busy, sometimes to get an appointment can take a little bit longer. And so I haven't had a chance to look into it, but our staff through the system, because you know, one of the questions I was asked is, can we just provide them healthcare to go outside of KFSH or MOH to access that healthcare? And unfortunately, that's not an option now. So we have to be able to figure out within our system how to make sure that you're able to access the care that you can, that you need. So this one I'll follow up on to ensure that we do have a process to make sure that our staff and their family members can quickly access the system. We talked about the housing and the location of the housing. Parking. So I will tell you, parking is the subject that is talked about, and with honestly no good answer at this point. It's you know, it's problematic throughout the campus. We do have you know, some drawings of where to build a parking garage, and you know, multi-deck parking garage and all that. And even within the budget, we do have 10 million reals dedicated specifically to parking as a project. The problem is 10 million is not enough to cover a multi-story parking garage, and building more land or surface parking will provide limited number of increase of spaces. So we're trying to figure out what's the best way to deal with this. We're also working or watching Dammam Central, because they do have a proposal to do a multi-story parking garage with a private-public partnership. And so someone will come and build the parking garage, and then obviously there'll be a small fee for their patients to access that garage. So once they work out the legal and the business terms of that agreement, we will then engage with the same company to see if that's something that we can bring to KFSH as a possible solution. But we don't have a good solution as of today in terms of something that we can implement tomorrow. Like I said, we have a strategy and a plan, but that will require lots of funding. And honestly, if it's spending X amount of money on clinical equipment or parking, chances are clinical equipment's going to win over parking. And so we have to figure out alternative solutions to it. The telephone at the compound, this one I need to get more detail. I can tell you the response that I got was that given that we're hopefully, inshallah, moving soon into the new compound, there hasn't been a priority given to fixing the phone lines in that compound. But I'll see. I don't know the depths of the issue. If it requires a lot of investment, then obviously it doesn't make sense if we'll move out in a couple of months. If it's something that's minimal, then we'll see if we can fix it. Hospital bills, this was asked last time, and I don't know if it's the same person or a new question, relative to paying electricity and water. So just to kind of make it clear, this keeps coming up on audits, external audits for us. From a legal standpoint, across all MOH and I think all compounds, non-MOH housing compounds, legally, the tenant or the person living in the villa or the apartment is supposed to pay electricity and water and a security deposit. And we get at first we were on the audit report for not doing this in the external compounds, and we addressed that. We still have an issue with the individuals that live on the hospital campus. The reason that this is more complex, and I think I've talked about it last time, is we don't have separate meters on each villa, and everything's connected to the hospital electric grid. So there's no easy way of saying, okay, this person is using this amount, this person is using this amount, versus outside of the hospital, we do have individualized metered units, which allow us to do that, right? So there is a committee that's trying to come up with a methodology that's as fair as possible to determine what is the appropriate amount that each, if it's a 4-bedroom, 3-bedroom, 2-bedroom, whatever it is, what's the appropriate amount. But it won't be exact and it won't be scientific because, like I said, there's no way for us to meter the individual. So the answer to the question is legally everybody's obliged to pay their electricity, water, and security deposit. But there must be a fair mechanism to do that, and at this point we don't have that fair mechanism within the hospital compound. Female, again, back to the gym in outside compound. So we did open up the gym. I think it's been maybe a month or so now, but we haven't opened up the pool. There's some, again, investment that would be required to get the pool open. Like I said, it doesn't make sense for us to put a bunch of money into a place that we will be moving out, inshallah, in a couple of months. So we did open up the gym component, but not the pool side of the gym. And the final one is the ATM machine within the hospital. We did make an arrangement with Al Rajahi Bank to open up, to have an ATM in the hospital. They haven't delivered the ATM machine yet, so we'll continue to press on them to get the machine here. But there is an agreement between us and Rajahi to get an ATM machine here at the hospital. Okay. All right. Thank you all for your time, and again, I appreciate all of the efforts. We do have one last section, which is the appreciation. I did get some questions about the names and how do the names come up, and other people have gotten appreciation. The way this process works is through our patient advocacy department. When they receive specific recognition names, they highlight them. But if I know a lot of times recognition comes directly to the department or other avenues. So all that we ask is, to make sure that that information is filtered to patient relations with the actual appreciation, so that we can do a certificate to acknowledge the exact reason for the appreciation. But this exercise is intended to be a positive celebration, not meant to alienate or make anybody upset. So we want to recognize as many people. Obviously everyone's doing a good job and a lot of good work, and we really want to appreciate it. The last thing that I forgot to mention, which is part of the appreciation, is really to the entire lab team and all the teams that help support them through their CAP inspection. We were able to have a very successful CAP inspection a couple of weeks ago. It was complicated because it was virtual, and it took a lot of IT to figure out how to make the entire hospital Wi-Fi enough to take tablets around and all that. But I know the lab team put a lot of effort, late nights, into making sure that we had a successful survey, and alhamdulillah, everything was great.
King Fahd Specialist Hospital in Dammam Executive Administration would like to extend this certificate of appreciation based on patient experience measurement program, who gets significantly higher than the average physician man score, which is 85.5%. Dr. Amira Balhara. دكتور شهد المعمر. دكتور سمية اسكندراني. دكتور فايز هندي. دكتور محمد البشر.
You need to start shaking hands.
دكتور جميلة الأزهر. دكتور نضال بوكاري. دكتور طارق مدخلي. دكتور بنجياتوس كاليجينيدس. دكتور سوزان الغامدي. دكتور وجود الخالدي. دكتور خالد درعان. Congratulations to all of our champions. At the end, I hope very nice and bright weekend. Please be safe. Thank you so much.